I really enjoyed the session because I did learn from my colleagues as well as the questions from the audience. A couple of things that I'd like to say are the question about whether we should provide services to refugees and take them to them versus taking them into our clinics. And we heard different responses, and I think depending on the situation, either of those would work. My own sense about that is to try to integrate them into existing primary care services, particularly as they become more transitioned into the local systems. They will be able to access more health care and specialties through the health system. Interestingly, when I first started doing this work about 16 years ago in our clinic, when I was having interpreters and I would ask a simple, straightforward question, they would often go on much longer. And finally I said to the interpreter, "Why are you saying so much when I asked a simple question like, is there any cancer in your family?" And the interpreter said, well, in our language, which was Karen, happened to be, we do not have a word for cancer. So I have to explain the word, and I will say things like the disease that makes you skinny and kills you. And that was very eye-opening, because then I became much more careful in my use of even common words like cancer, which in America everyone of course knows, but which in many languages doesn't even exist. And certainly moving into psychological terminology, many languages don't have words like depression or post-traumatic stress disorder, even anxiety. So when we're dealing with patients and there are many emotional problems, we have to use language that's from them and not from us. So if a patient tells me that they're sad or they're crying, or even if they have back pain, I often have to use those words when I'm addressing treatment, and I'll say, well, I want you to feel better. I want to help you with your sadness or with your tears and your crying spells, and I'd like to offer you some medication that would help, or I'd like to offer you a visit to a special doctor who can help you even more with this problem.